because it's IBS Awareness Month this month, I wanted to do short little snippets of information on IBS. So I want to start off by looking at what exactly is IBS and really understanding irritable bowel syndrome. So it's termed a functional gut disorder. So what that means is the digestive tract actually looks normal. There's no structural damage or disease, but it doesn't function normally. And it's seen as a miscommunication between the brain and the gut. So the terminology is, it's been termed that it's a disorder of gut-brain interaction. So we know it's chronic. It lasts for more than 3 months and, often a lot longer. And it doesn't show up on any scans or blood tests. The diagnosis is based on symptom patterns. And it fluctuates between people. Some describe it as having good days and bad days. And the common symptoms, you can have all sorts of gut symptoms, bloating, gas. You can fluctuate between constipation, diarrhea, and bowel movements. There could be an urgency to go. It is often misdiagnosed or misunderstood. It can be seen as a broad umbrella term for lots of gut symptoms. But there are various key factors which can be looked at why your body is dysfunctioning and what is happening in the body when you do have IBS. So that will be the next clip. So stay tuned for the key factors of IBS. So we know it's a gut-brain connection. So that's one of the key factors. The gut sends signals up to the brain. The brain will send signals down to the gut. So it is a bidirectional pathway, and that happens via the vagus nerve. And there's involvement of neurotransmitters, hormones, and immune messengers in there. So if this signaling communication becomes dysregulated, that can cause the brain to misinterpret normal gut signals. And, that could be misinterpreted as pain and discomfort. And of course, stress and emotions can trigger digestive symptoms. And that, disrupted signaling can cause abnormal gut motility and heightened pain and various digestive symptoms. Now, the other key factor is immune activation. So with this, we have a lot of our immune system in the gut lining. And research shows that many IBS patients have low-grade inflammation going on in their intestinal lining. So, for various reasons, the integrity of the gut barrier may not be optimal, and that can irritate the gut nerves and disrupt normal function. And so that, a persistent immune response can cause inflammation, and that could be, after infection. So there's post-infectious IBS. It could be triggered by food sensitivities, and all of this stuff can contribute to the various IBS symptoms. So there's very much an immune aspect to IBS condition as well. Next key factor is visceral hypersensitivity. So what does that mean? That means that for IBS patients, those feelings of normal gut sensations are different. They can be heightened, so they can be quite painful and uncomfortable. We have millions of nerve endings in the gut that communicate with the brain. And we've already, talked about the gut-brain communication. And so if that's disrupted, then those nerves can become overly sensitive, and that can heighten those feelings of normal digestion and could cause quite significant discomfort and pain. And so, this impacts gut motility, feelings of gas and movement and digestion issues. So the pain sensation is becoming hypersensitive in IBS patients. The other key factor is, of course, chronic stress. Now, stress impacts pretty much everything in our health and well-being. So for the gut, it's no different. We have stress hormone cortisol, which, if you're in a state of chronic stress, that's going to be elevated, and that will have an impact on digestion and gut motility, movement. So, there can be feelings of constipation if you're highly stressed. It can also impact your gut lining and how, good and intact your gut lining is, meaning that, immune inflammatory responses leaking into the bloodstream, that can be a factor as well. So stress really impacts the whole digestive process, and that will impact IBS as well. The next one is the gut microbiome, which is really, really, crucial and integral to the whole IBS picture. So when we say dysbiosis, we are talking about an imbalanced gut microbiome. So an imbalance in the diversity and the composition of that, the beneficial ones and the potentially harmful gut microbiome. So we want it to be in a good composition, in a good diversity. So because that imbalance can cause all sorts of problems, including digestive troubles. It can impact the immune function and the integrity of the gut barrier, and trigger inflammation. And, the gut processes our food, but if that bacteria is in a disrupted state, it's going to impact fermentation, and, excess gas can be produced that can manifest as bloating, pain, irregular bowel movements, and all of those things can impact whether you have an IBS, predominantly diarrhea IBS, or a constipation IBS, or it could be a mixed fluctuating between diarrhea and constipation. So there are different IBS subtypes, and a lot of it is coming from the gut dysbiosis and how the composition of your gut microbiome is looking, and we can determine the type of IBS you can present with. So the microbiome is hugely, hugely important in the IBS picture overall. The next key factor is diet and lifestyle factors. So this is something that we can absolutely control. It is within our control. So with this, what's happening is, certain foods may be more, intolerant. We may be more sensitive to certain foods in IBS. But, usually it's not the food itself, it's the terrain. So we come back to the microbiome, the environment that the food is being put into. So, it's a different way of looking at it, and often we think it's the food that, is the problem. So comes back to the gut microbiome. There could be irregular eating patterns and, lifestyle factors, poor sleep, lack of exercise if we're sedentary, instead of being active, stress, sleep, all of those things can worsen IBS symptoms. The kind of, food that we eat, FODMAPs is something that's very much discussed in IBS. So fermented foods, fiber, although fiber is very useful for us and for the gut microbes, it may be that IBS patients cannot tolerate too much fiber because there's that excess fermentation, excess gas going on. Other foods like caffeine, alcohol, fatty foods, they can all trigger symptoms. So from a food point of view, very much within our control. Regular physical activity really helps. So lots of things that we can do in terms of diet and lifestyle in the management of IBS symptoms and trying to improve. So now that we've looked at the different key factors that could be going on when a person has IBS, let's look at the what to do about it. So What's really important to understand first is that it's not a single cause. It's very much a multifactorial condition, and there's no one single solution. So usually it's a complex interaction, different imbalances going on in the body, and with different root causes. So the different key factors we've talked about in previous clips, there could be a mix of these going on, and it will differ from one person to another. So one person's IBS is not the same as another person's IBS, and symptoms can vary, so which means the root causes can vary. So there's no one solution that helps all IBS sufferers. So that's why it's really a personalized approach, a real personalized management, and it has to be an individualized approach to get support with. So what works for one person may not work for another, and even what works for you at one point in time may differ over the course of the period. So it may not work again, at another time. Because our bodies are always changing and evolving and interacting with the environment that's always changing. So microbiome is always changing. So personalized management is really important, and we have to understand the individual triggers, take a real holistic assessment of the history as well, what things could have preceded the development of IBS and what things are currently still happening that's enabling IBS to continue. So it is really, things looking at the whole picture. So looking at management of IBS, what can we do to manage the symptoms? So the common symptoms that we have, which, there's always a reason why it's happening, and it's analyzing and investigating which processes in the body where it's being disrupted or dysfunctioning and needs support. And we can look at diet and food triggers. So, what's happening in the diet, what are the food triggers that the body can't seem to tolerate? Remembering it's not the input, it's the terrain. So what's going on in the gastrointestinal tract, where in the digestive process it's dysfunctioning, what's going on with the gut microbiome that it can't tolerate the foods that it's being put in. Lifestyle factors, very much an issue, highly relevant in IBS, sleep, stress, exercise, all of these has a knock-on effect on symptoms. So stress is a huge thing, and that means that the digestive process is not going to function if we're highly stressed. So that can lead to sluggish bowels, toxic load, inflammation. So all of those, constipation, bloating symptoms can appear. If we're thinking about nutrient status, what nutrients can we support the body with in order to get things functioning and moving along again? What are we not absorbing? Supplements we can aid with to help the digestive system heal. We can think about microbiome testing too, stool testing, which will give us more of an idea of what's going on, and genetic testing as well. So what, gene variants you have that is not really helping the condition. So there's lots we can assess, which will help.